So the diagnosis is acute asthmatic bronchitis with laryngotracheomalacia. So what happens in laryngotracheomalacia? There is, you have in the trachea, you have cartilage, right? So those cartilages and the muscle are very weak. It's not properly strong. So when there is a spasm, the muscle goes inside or droops inside. So that is the thing which gives rise to stridor. So usually you get stridors in cases of, just pure laryngotracheomalacia also, where there is history that, parents will give that it is, since the birth, the child has a very noisy breathing. So you usually see it in the very initial stages, and it usually lasts for about a year. That's when the tone of the muscle, once the tone of the muscle improves, the laryngotracheomalacia, the stridor, because of that, will gradually reduce. Now here, the laryngotracheomalacia was not that intense for it to be present always, but whenever he has come down with an asthmatic attack, the laryngotracheomalacia symptoms will become more prominent. That's the reason that we are able to hear such a loud wheeze. So the observation of the mother, we asked, is there any specific time that this wheezing is better or he is more comfortable? The mother is like, when he is sleeping, we see that the wheeze, the audibleness of the wheeze goes down. And when we observed in the ward, the child was sleeping on the back with outstretched arms. So we asked the mother whether, the child always sleeps this way or, what exactly is the sleep position usually. So mother is like, this child usually sleeps on the sides, but now when these attacks are there, he is sleeping this way. So is it an important observation? What do we conclude out of it, and what remedies can you think of? Exactly. So it is a keynote of Psorinum. So we formed this totality. This was the only totality which was available. Respiration, whistling, awake when, dyspnea better lying on back with outstretched arms, and dyspnea better by sleep. So Psorinum is the only remedy which covers better lying on the back and on waking. So we gave the child Psorinum